Thomas Wilken has had major heart surgery. Now, whenever he goes out and thinks that something could be wrong with his heart, he can pull out his mini-ECG monitoring device. With the help of an app called CardioGo, he can send it to a cardiologist, who will analyse the data and respond.
Weil ich mich so ein bisschen unwohl fühle.
So far, Wilken has only had to use the app once.
Ja, ich habe also sehr positive Erfahrungen gemacht.
I've had very positive experiences. Within a very short period of time, just 3 or 4 seconds, I had a cardiologist on the phone. He took a look at my ECG and luckily he said everything was fine. So afterwards, a patient is relieved. And that's exactly the purpose. You can be certain about it.
Man ja sicher sein kann.
Usually Wilken is a patient of cardiologist Jens Biermann in the town of Wedel. 5 years ago, Biermann teamed up with the Hamburg-based company LLR to create the CardioGo app. He had noticed that many of his patients wanted to feel secure on weekends and while on vacation. The service costs just under €2,000, including 2 consultations. Patients pay extra for additional consultations. But that gives them access to a specialist in Germany around the clock. A team of 22 cardiologists participate in the program. And whenever necessary, they advise patients to visit a nearby clinic.
Die Patienten, die ganz am Anfang mitmachen, sind unsere Pioniere.
The patients who've been taking part since the beginning are our pioneers. Most of them pay for the service themselves, proving that it works. Then we can offer it to insurance companies or maybe even to politicians, so they'll recognise that it could eventually be made available to everyone. German health insurers are still sceptical about new health apps, especially when it comes to privacy laws. It's also still unclear which apps are most practical. At the moment, insurers believe patients should deal directly with the service providers. Everybody should decide for themselves if they want it or not. There's also the issue of whether to make it available for all 70 million people with statutory insurance. And there's no concrete proof that these apps really do offer additional benefits. But patients like Thomas Wilken are already convinced. He would have paid on his own, but due to his heart disease, his insurance provider agreed to cover 100% of the costs.